Welcome back to Two Wants to Know. We're talking about COVID-19, the vaccine. We're taking your questions. You can text those questions to 336-379-5775, the number right down at the bottom. Cone Health Chief Pharmacy Officer Dr. Deanne Brooks is here to answer your questions. All right, this person is asking, my 37-year-old daughter had her first Pfizer vaccine on April the 6th, and the shot spot is still hot to the touch and it's itching. Is that normal?
So it's unusual to see a reaction like that for this long. We're talking about almost 2 weeks after. If it's not causing her any trouble or swollen or infected looking, I would probably just watch it a couple of more days. But if there's any question at all, if that redness is extending, I would reach out to their healthcare provider.
Mm-hmm. This person is asking, do you think it helps to drink lots of water and take Tylenol before and after having the COVID-19 vaccination?
Yeah, well, I think hydration is always important for everything. And there is some data that would support not taking Tylenol or ibuprofen before you have your vaccine, but you could take it after the vaccine for any symptoms that you may have. And it doesn't mean that if you took a dose of Tylenol or ibuprofen that morning that you should skip your vaccine appointment. Just if you have the choice, I would just wait until afterwards.
And can you explain to people why that is?
Yeah, it has to do with the immune system and the thought that if you have that Tylenol or ibuprofen, could it potentially hinder your immune system a little bit so that the vaccine would not be as effective. But it's really more just getting down into the details of that science. And like I said, I would not prevent myself from getting the vaccine if I took a dose of Tylenol for a headache that morning.
Mm-hmm. Question is, do you need to show an insurance card to receive a vaccination?
You really should not need to, because the vaccinations are free. We don't ask at Cone Health to see that. Some vaccine providers may ask for it to get information, but we don't require that.
And speaking of Cone Health and vaccinations, you can basically walk in and get a vaccination.
Yes, you can. So very different, as I shared before, about the supply of the vaccine. Right now in our community, we do have vaccine appointments that are available, and you can sign up and often get an appointment that very day. And in case you just happen to be driving by one of our sites at the Coliseum or at Eric Lane at the J&J Center or up at Rockingham Community College, we actually will take a walk-in as well. We prefer for that to be 2 hours before we close so that we can make sure that we do have enough vaccine there for you. But yes, you may now walk in to get a vaccine.
What a difference just a couple of months makes. Yes.
Yeah.
Mm-hmm. All right, this person is asking, is it normal to have numbness and tingling in your arm after the vaccination?
Yeah, it's a possibility that that could be a reaction. It's not something that you would expect for it to last very long.
All right, how long do I have to wait until after my second COVID shot to get my shingles vaccine?
You should wait at least 2 weeks before you get your next vaccine.
Okay, 2 weeks. And then this person is asking, 2 weeks after my Pfizer shot, can I still catch COVID or be a symptoms carrier?
You can actually, yes, and that speaks to the importance of us continuing to wear masks, as we talked about before.
Okay, and this person says, can someone who has had COVID donate blood?
Oh, that's a really great question, and
we might have to direct them to the Red Cross.
Yeah, I'm going to have to direct them to the Blood Cross. I'm not a Red Cross, sorry. I'm not actually sure about that. I haven't seen that answered. I know that what I know about giving blood is that it's tested for viruses, and I believe we are asked before we give blood if we have had any illness or sickness. I'm sorry to say I haven't given blood in the last couple of months, and I need to do that. So I'm going to need to do that.
That's a good reminder for all of us. All right.
It is.
Thank
Yes,
you
it
so
is.
much, Doctor. We appreciate your time and your expertise. If you missed any of this, what you can do is go to the Two Wants to Know section of our website.